All right, today we're diving into the story of a medication that is, well, a true medical balancing act. Let's get into it.
So let me ask you this. How can one single pill treat seizures and excruciating facial pain and bipolar disorder? I mean, these things sound like they're from completely different medical universes, right?
Well, that's where the balancing act comes in. The answer is this really delicate, high-stakes trade-off. On one side, you've got these incredible benefits, and on the other, some pretty significant risks. And that's what we're going to unpack today.
Okay, so let's start with the good stuff. Let's put some weight on the benefit side of the scale. You gotta understand, this isn't some niche medication. For decades, carbamazepine has been a go-to, a real cornerstone drug for doctors dealing with some really tough conditions.
So what's it used for? Well, it's a powerhouse for certain types of seizures and epilepsy. And then there's this condition called trigeminal neuralgia. We're talking severe, like electric shock to the face kind of pain. For that, carbamazepine is often the very first thing doctors try. Plus, it's used to get manic episodes and bipolar disorder under control. That range alone is just pretty amazing.
So what's the secret sauce? How does it tackle all these different problems? Well, it all comes down to calming an electrical storm inside your head. See, in all of these conditions, the fundamental issue is the same. You've got neurons, nerve cells, that are just going haywire, firing way too fast, way too often. Carbamazepine's whole job is to step in and say, okay, everybody, just calm down. And here's the really cool part. The mechanism is just elegant. It's called use-dependent blockade, which is a fancy way of saying the drug is smart. It's not a sledgehammer that just knocks out all nerve activity. No, it's more like a sniper. It specifically goes after the problem neurons, the ones that are firing like crazy, and pretty much leaves the healthy, well-behaved ones alone.
Okay, let's break that down. Picture the sodium channels on your neurons like little turnstiles. For a neuron to fire, a turnstile has to spin. Now, during a seizure, these turnstiles are spinning out of control. After every spin, the turnstile has to briefly lock itself. It goes into this inactivated state before it can reset for the next spin. What carbamazepine does is it comes along and finds those turnstiles that are being used way too much, and it basically puts a lock on them while they're in that inactivated state. It keeps them from resetting. The result? The crazy firing slows way down. And the turnstiles on your normal neurons, since they're not being overused, the drug just leaves them alone.
So you see, it's all about precision. It's reducing that high-frequency, dangerous firing without messing up all the normal communication your brain needs to do every single second. And that is a huge plus. Okay, so it sounds pretty great, right? A smart drug that calms the storm. But this is where the story gets a lot trickier. Carbamazepine is not a simple set-it-and-forget-it kind of pill. It does something really weird that makes it a huge challenge to manage. It literally teaches your body how to get rid of it.
They call this auto-induction. Think of it like this. When you start taking the drug, it sends a message to your liver saying, hey, you're going to be seeing a lot of me, so you better ramp up production. So your liver builds a bigger, faster factory just to break down carbamazepine. The crazy part is, over the first few weeks, your body gets so good at clearing the drug that a dose that worked perfectly on day 1 might be practically useless by week 3.
And you can see this effect really clearly when you look at the drug's half-life. That's just how long it takes for half of it to clear out of your system. When you first start, it can stick around for up to 65 hours. But once your liver's new factory is up and running, it can drop all the way down to just 12 hours. That is a massive change, and it's exactly why doctors have to keep bumping the dose up during that first month.
All right, we've talked about the power, we've talked about the complexity. Now, we have to go back to our balancing act. It's time to talk about the other side of the scale, the risks. And believe me, these are some seriously heavy counterweights.
First up, you have the more common side effects. Things like feeling dizzy, drowsy, maybe a bit unsteady on your feet, especially when you're just starting out. A lot of this is related to the dose and can get better, but still, it's not fun and can really mess with your day.
But then we get to the really serious stuff, the black box warnings. And this first one is no joke. In rare cases, and I want to stress it is rare, this drug can cause your bone marrow to just stop making blood cells. It's a condition called aplastic anemia, and it can be fatal. This is why it is absolutely critical for patients to report any fever, sore throat, or easy bruising right away, immediately.
The next big warning is about a terrifying, life-threatening skin reaction called Stevens-Johnson syndrome, or SJS. And here's something fascinating and incredibly important. There's a genetic link.
Your risk of getting this is way, way higher if you have a specific gene called HLA-B1502, and this gene is most common in people with Southeast Asian ancestry. It's a perfect, if scary, example of how a simple genetic test before starting a medication can literally save your life. And the list doesn't stop there. It can potentially cause liver damage, which is why regular liver function tests are a must. It can also make your sodium levels drop dangerously low. That's called hyponatremia, and this is a really big worry, especially for elderly patients.
Hey, remember that whole autoinduction thing where the drug teaches the liver to build a bigger factory? Well, that factory doesn't just process carbamazepine. It speeds up the breakdown of a ton of other drugs, too. It revs up the liver's entire drug-clearing engine, and that has huge, huge consequences for pretty much any other medication you might be on.
What does that mean in real terms? It means it can make other drugs weaker, less effective. We're talking about other anticonvulsants, crucial blood thinners like warfarin, even antidepressants. But here's the one everyone needs to know. It can make birth control pills fail. That is not a small detail. That's need-to-know, life-altering information.
Okay, so after hearing all of that, you might be wondering, why on earth would anyone use this drug? Well, this is where we get to the art of medicine. It's all about how doctors manage this balancing act to make sure the scales tip heavily in favor of the benefits.
And the strategy has a simple mantra: start low and go slow. A doctor will start you on a tiny dose to let your body get used to it. Then they'll gradually, week by week, increase it. And all the while, they are watching you like a hawk, doing blood tests, checking drug levels, and looking for any hint of those serious side effects.
And those blood tests are super important. They're looking for a very specific sweet spot, a target range of 4 to 12 micrograms per milliliter in your blood. If you're below that, the drug probably isn't working. If you go above it, your risk of dangerous side effects skyrockets. So staying right inside that narrow little window, that is the absolute key to making this drug work safely.
When you look at the whole picture, carbamazepine is just a perfect example of a medical trade-off. There's no denying it's a powerful, life-changing medication for so many people. But it is not a simple solution. It's a drug that really demands our full attention and our utmost respect, because it reminds us that in medicine, great power often comes with the need for even greater caution.